Hi, my name is Eric Clayette. I'm a Senior Director with the Fund for New York City Health and Hospitals. I'm here to talk to you about our program, which is called Guns Down, Life Up. It's a hospital-based, community-centered program. The program actually has three specific components. There's a mentoring component, there's a community mobilization component, which we call Circle of Safety, and there's a hospital intervention component, which I'll talk to you about. So the mentoring component really is designed to work with young people pretty much from 11 to 18 years of age. Our goal is to provide them with positive things to do with their otherwise free time, so they don't have the time or energy to hurt themselves or hurt other people. We believe that this is a long-term play. That is to say that the mentorship is to last with young people starting in middle school and following them all the way through high school. We believe that consistency and long-term mentorship is what helps young people stay out of harm's way. And in our programs, we focus on life skills, things that we think that will add value to their lives: exercise, health, finance, relationships, all those sorts of things that we can engage young people with and about such that they can live long, productive lives. Our second component is a circle of safety. A circle of safety essentially is a coalition of concerned men and women from a specific community to talk about the issues of violence in their community. We believe that people from a community have a very, very good sense about what goes on in the community. They know who the purveyors of violence are, they know who the victims are, and they probably have good ideas about the solution. So at a Circle of Safety meeting, which we do monthly at our hospitals, we might have someone from the district attorney's office, we might have someone from the police department, we may have school teachers, we may have a couple of business owners, along with administrators from the hospital and community members. That's to say that you want a broad net of people around the table to bring ideas and energy to talk about specific violence injuries or violence incidents that are taking place in a specific community. On the third component of our program is called a hospital intervention. We work with men and women who are recognized as credible messengers. They're credible because they have a relationship with street life or gang life and have decided that they have redirected the energy of their life towards positiveness. So when we have patients that come into our facilities with a gunshot, a stabbing, or an assault, our hospital responders will sit bedside, talk to these patients, and hopefully redirect their energy, i.e. direct them away from retaliation. We're hoping to stop the cycle of violence. We're hoping to make sure that young people live long, productive lives. And we also want to enrich these young people by sharing with them opportunities that they may not be available or mindful of while they're staying in the hospital. This essentially is what Guns Down, Life Up is. It's an approach that we use in the New York City Health and Hospital System. As I said, it's a hospital-based program, but it's community-centered, and we believe that the work that we do helps reduce violence and injury across the board. At our Circle of Safety meetings, particularly in our level 1 trauma facilities, we address data. We look at the statistics that will let us know how many shootings, how many stabbings, how many assaults, and from that data we can think about the best way to address our efforts to address violence or injury in a specific community. So again, my name is Eric Clayette. I'm a Senior Director for the Fund for New York City Health and Hospitals. Thank you for the opportunity to talk about Guns Down, Life Up. There's the long-term mentorship. Keep them out of harm's way. Don't ever even let them get shot. Don't let them get involved. That's phase 1. Get them very early. Phase 2, let's be organized. Let's look at the data. Let's talk about the issues. Let's talk about what we have to do, when we can do it, to make sure that young people are out of harm's way. And when there is an issue, what do we put in place to kind of quell that issue? In phase 3, when somebody is hurt, they're in our hospital and they're in our facilities, we have our credible messengers bedside trying to dissuade them from reenacting into violence, right? All of those things together, that trifecta together, we believe is critical in reducing injuries and reducing injury rates.
Offer them alternatives, like the hospital responders component is so important, but you have to offer them something. When they can't just get shot and put them back there on the corner, the same corner, without no resources, no alternatives. So you have to be there on their bedside. That's an important component. I'm a responder in Queens, and I sat next to people who, they didn't even want to retaliate. They just felt they had to, but they peer pressure their friends. And I said, look, you're going to have your mother come and visit you upstate. I've been there, you know what I'm saying? You're going to go 8 hours, you're going to be upstate, or your family members have been affected by it, and your friends. So it's kind of being consistent, like you said.